My name is Dr. Angela Coombs. I'm a chief resident here at Columbia, and we are so happy to be able to have Dr. Diana Martinez, who's a professor here in psychiatry at Columbia and an expert in addiction psychiatry. So we are talking about none other than CBD.
Absolutely. Glad to talk about it. One of my favorite topics.
So I think everyone wants to know off the bat, when it comes to CBD, what really are the medical indications? What do we know about its use for different illnesses?
Well, the main thing you can say about CBD is that we know very little about it, unfortunately, in humans. I would say, out of the gate, the most important things to know about CBD is that there is promise based on animal studies and preclinical studies. There is some studies being done in human volunteers that suggest it has medicinal effects. For the most part, we don't know a lot about it, and we certainly don't have great sources of CBD available to people and patients out there. And those are, I think, the biggest issues.
Right. It seems like there's a concern, particularly when, a patient comes to you and says, I'm interested in trying CBD for this thing, whether it be anxiety or pain, even knowing where you would direct them if they were to go pick up CBD. Where should they go get it? Where should they not be getting it?
So I get asked this question a lot. And for the most part, what I say to my patients or colleagues of mine who ask about their patients is I say that the CBD that you see for sale at the bodega or the grocery store or the whatever it is, the mall, there's little booths now at the mall, for the most part aren't likely to have the doses of CBD that they advertise. And so I would only go for sources of CBD where you can see the certificate of analysis where the company posts it. So as I would do, if I were buying CBD, I would go to websites, companies that post the certificate of analysis called the COA that lists the amount of CBD contained in the product plus contaminants. You want to see if they test for pesticides, heavy metals, these kinds of things. For the most part, I would say the best product that I've seen is from Colorado because of the testing that Colorado does. And you want to make sure that that COA is from an outside laboratory, that the company posts what laboratory tested it and the date that it was tested. Because remember, these are plant products. There's a lot of variability from batch to batch. So that certificate of analysis needs to be done on a very regular basis.
So maybe it might be helpful for our audience for us to take a step back and, in your opinion, what are some of the most promising opportunities for CBD use?
So for at this point, what we know about CBD in human patients is that it's effective for seizures. That's specifically children with Dravet syndrome or Lennox-Gastaut syndrome who didn't respond to other medications. So that's a very selective crowd. And that was a very high dose of CBD that was effective in those children on the order of about 1,000 milligrams. There are a few studies with schizophrenia showing that CBD is helpful in reducing some of the positive symptoms of schizophrenia. Importantly, those studies are done in patients who are taking their medication. It's not a replacement for antipsychotics, but it seems to be helpful as an adjunctive therapy. That data still needs to be strengthened a little bit more. After that, we get into a very big gray zone. There is a little bit of research with anxiety. This is mostly done in healthy volunteers who are made anxious by doing things like talking in front of a camera or in front of a group of people who are given placebo and then CBD. And there's evidence showing that CBD did decrease anxiety. But again, does that translate into a patient with an anxiety disorder? It's not really clear. There's a little bit of research done in patients with social anxiety disorder. But again, those tend to be a single dose of CBD decreasing anxiety. And it's a small study. So does CBD, that's one of the biggest things you'll hear is that CBD is useful for anxiety. It may be. There's some evidence to support it, but there's really not good, hard research, placebo-controlled studies in large numbers of ill patients and patients with anxiety disorders supporting that. So a lot of patients do take it for anxiety. A lot of people on the street take it for anxiety. Is it a placebo effect? It may be. We don't know.
So then I wonder, for a patient coming in to see you and you're collaborating and they're really sort of very motivated to get access to CBD, what recommendations do you give them when it comes to dosing or how they would administer it?
I'm very clear that the dosing is largely unknown. The studies in anxiety suggested that around 300 to 600 milligrams was what was effective in the healthy control, so that's the dose range that's probably needed. If you go online and buy CBD, lots of times people spend $50 on a bottle that has 50 milligrams of CBD. That's not going to do much, right? So you have to be careful about how much people are taking. And the other thing to know about CBD is that the studies in epilepsy patients did show that there are interactions with liver metabolism, the CYP system, of other medications. Now, again, these are pediatric patients taking other anti-epileptic drugs, taking 1,000 milligrams. So we don't know if lower doses of CBD do interact with other medications. The patient should be careful. And certainly if you're taking in the hundreds of milligram range, you need to think about these things. Like, does it interact with antipsychotics or antidepressants?
So I know that one question you definitely get asked a lot from people who might not have much exposure to CBD is, first of all, is it even legal?
That is a question that at this point I can't even answer. I have followed that closely because it's important for my research to know the legality of it, because that determines how we get approvals to do our studies. But at this point, I really can't answer that question. I used to try, but between the Farm Bill and the DEA and the FDA, you get different answers. So it's really unclear. What's more important is, will it be regulated rather than is it legal? And that is also unclear. And I think, though, that's an important question because there is some real promise to CBD in terms of treating various disorders, and it should be regulated, especially if patients want to use it. So that's what I would say is a big hole.
Oh, great. Thank you so much for your time. This has been very helpful. So I'm Dr. Angela Coombs. This is Medscape with Columbia.